Okay. Hey everyone, welcome to the MMOA podcast. My name is Shelby Blankenship. I'm one of your TAs with the MMOA division. And today we're going to be talking about hydration for the older adult. So, one of the things that I think, especially as it's gotten a lot colder outside, is that people are less aware of their hydration status overall, but especially for our older adults. Most older adults, especially when they get into those latter ages, tend to really struggle with being aware of if they're having thirst, and that sensitivity really goes down. But especially if there's any cognitive impairment on board, that can really be affected here. So we're going to kind of talk about the importance of hydration, some articles that might be you should be willing to kind of like read through and kind of get your most up to date evidence, and then just kind of next steps for research that is currently going on. So, we kind of talked about just a second ago that older adults are the most susceptible, especially when they're living with multiple comorbidities as far as dehydration goes. And hydration is really crucial for the whole body. It plays a lot of roles in thermoregulation, blood pressure maintenance, which I think can be a huge, huge issue with this population, biochemical reactions, and then transportation of nutrients and removal of any waste from the cells. When we are born, like infancy or to infancy, usually the amount of body or water in our body is about 75%. And then as we get older, it actually decreases to about 50 to 60%. Um, this just is like a normal part of aging, but definitely kind of gives us some insight of how important it is to get water intake that is really purposeful rather than just like automatic. Especially when you're an infant or when you're a child, it's mostly people just giving you things and you're taking them in, probably not being as super helpful as, especially if you don't like a certain type of drink. But as we get older, it's very important not only from a hydration standpoint, like for thirst, but also it can help regulate cognition. If you're not getting enough hydration, it can severely affect your cognition and like neuro status. Most people who struggle with hydration are going to also struggle with like headaches, is something that tends to pop up. You'll also see an increased risk of like metabolic diseases, so like diabetes. This population really struggles with hydration, especially if like sugar intake is high in the drinks that they're drinking. And then renal diseases. So, chronic kidney disease or maybe a potential for chronic kidney disease, it gets a little bit trickier about how much hydration. The evidence is a little bit kind of wishy washy on this, as far as like how much specifically that each individual should be having, according to this article that I'm going to have linked in the notes. Um, Basically what it's saying is, especially with somebody with like chronic kidney disease to the point where they're on dialysis, we have to limit the water intake to make sure they're not getting too much fluid retention, which can cause a multitude of other issues. But we also want to make sure that if somebody's kind of like on the earlier ends of chronic kidney disease, that we help that renal system with appropriate water intake, especially because our tendency is that as we get older, the renal system has a hard time concentrating the urine. Like it just has a hard time like keeping it concentrated and regulating it as well as it did when we were maybe in like our 20s and 30s and younger. Another system that we want to kind of watch for as well is the GI system. We hear a lot about like constipation, especially in this group, not only from like a food what they're taking from a food intake, but sometimes it's also medications, like it's just causing a lot of constipation, or the amount of water that they're intaking is limiting the stool from becoming like an actual good you don't want it too solid, but you don't want it too water either. And then if we're not getting enough water intake, it can really impact the type of stool. There's a chart called the Bristol stool chart that gives kind of the variations of what your stool can look like based on a multitude of factors, but hydration really being one of them. And if you tend to have these like really hard, kind of pebble like consistency feces, that can be one, super hard to get out, literally, and two, it can really show the impact of being dehydrated for this population. And that could be for any age, but especially this population. And then the last one that I want to talk about as far as body systems is concerned is skin. So, it's the largest organ in our body, but especially as we get older, skin integrity becomes even more crucial because wound healing times tend to get more affected. So, if you're having issues with skin integrity, especially if it's really, really dry skin, that correlation between dry skin and lack of hydration tends to be there. I know personally the medicine that I'm having to be on for my long journey with histoplasmosis from a year ago has severely dehydrated my skin, and it has actually made it more prone to skin tearing. Which is super annoying and very frustrating. But imagine like you're in your 80s or 90s and functionally really struggling, and then you're also having these skin issues where maybe your body is having a hard time healing, so you're going to end up being more prone to infection and those kinds of things. So trying to maintain that skin integrity with having that hydration level can be super, super helpful. um so this article kind of went on to kind of say like, okay, so how, we know all these things about hydration and dehydration. Like what do we do to kind of test if maybe one of the individuals in front of us has those has dehydration? And one of the things that I thought was interesting is, we talked about like the skin turgor test where like you kind of like pinch your skin up and see how long it takes to disperse back. And basically it was saying like the combination of that, heart rate, mouth dryness, thirst sensation, urine color is one that we've used a lot in the past, and urine gravity aren't always the best when it comes to sensitivity and specificity. Usually, they're kind of in this article specifically, they're trying to come up with other realms that are a little bit more specific, especially for the older adult. And they kind of go into like, there's a term called the total body water, so like, the total body water in like your entire system. And we talked about earlier how it kind of decreases as we get older, but using that in the plasma osmolality that's in there to see like what's the concentration there to see if dehydration is really a component for that individual, making it a little bit more specific. Now, I'm not saying to not do those tests. Please do those, but make sure you're doing it in like a summation rather than just one specific one. We definitely can't do, a plasma osmolality test. First off, I don't have any of that equipment at my place. I'm assuming you don't either, but that's just kind of something to keep in mind that sometimes that's not as specific as we would like it to be, but definitely talking with PCPs or if you're in a hospital like the hospitalist, if those are concerns, um, you know, at a hospital, you're going to have more access to doing like an IV or those kinds of things, or versus like an outpatient setting. But you definitely want to kind of be mindful of those, especially if you're noticing some changes in their body systems, like we talked about before with cognition, metabolic diseases, renal function, GI, and then skin, of course. So just kind of keep those in mind. A couple just little tidbits of things I wanted to just, little factoids, if you will. I thought that were super interesting is that fat is 11% of water, 11% water, and then muscle is 75%. So actually, the more muscle you have, the more total body water that you have in your system. So again, going back to what we love to preach in MMOA, like more muscle tends to be the way to go. And we definitely want to hope that for our clients, not only from a functionality and body mass perspective, but also from a water and hydration. So we definitely want to keep those in mind. Um, so kind of summing everything up, hydration in our older adults tends to be a big problem. One, not only from losing that thirst sensation, but especially when it gets cold outside, we tend to not notice like us sweating and all those kinds of things versus like especially in session, our gyms and our treatment rooms tend to be a little bit colder. So just kind of keep that in mind when you have your clients in there, trying to have water accessible, whether it's free or even just the cups to kind of keep people hydrated. Because most of the time, people need that prompting, especially if like cognition is a problem. Like especially like dementia, or if they have any kind of delirium in the hospital, like prompting them to drink water is a great idea. Hydration's essential when it comes to like thermoregulation, blood pressure maintenance. I've seen that a lot. If people are not drinking enough water, they really, really struggle with maintaining their blood pressure. So keeping that in mind, biochemical reactions, and then that transport of nutrients and removal of waste from cells. And there's two types of dehydration that we want to look at. There's salt loss versus water loss. So, salt loss, we're getting a loss of electrolytes and a loss of water. Water loss, it's more of like you're just not getting enough intake. Sometimes that can be from, like vomiting, diarrhea, those kinds of things. So, kind of being mindful of like there are multiple types of dehydration, and it's not always like electrolytes being the first to go, and it's not just water. Like sometimes it's a combo of the two. Again, reiterating the importance of the systems that hydration can impact, and that we need to be checking for hydration levels. The the ways we do that are not super sensitive or specific right now, but trying to like wrap our head around like that skin turgor test, heart rate, mouth dryness, sometimes urine color, and being sure to refer out if needed to make sure that we're getting the optimal hydration level for each of our clients, because it's not always going to be the same and we're not with them 24 hours a day. I know a lot of people, especially if incontinence is on board, they really limit their water intake, which can really impact their hydration level and then ultimately impact these other systems. So that's a kind of quick summation of the hydration for older adults. I'm going to list a couple articles in the notes so that you can check those out if you're interested in learning a little bit more specific about this topic. And I just wanted to go ahead and let you guys know we don't have any more classes for 2023, but we do have some coming up for 2024. So, MMOA Live, we have Marysville, Ohio, and Santa Rosa, California coming January 13th and 14th. Those are our first live classes for the new year. The L1, which was previously called Essential Foundations, is starting January 10th. And then we have our L2, which was previously Advanced Concepts, starting January 11th. If you want to keep that lower price of $650, you want to buy your tickets now in December, because the price is going up in January. I hope y'all have a great rest of your day and a really great holiday season wherever you're celebrating. And yeah, thanks so much. Bye.